Hello, everyone. I'm Melissa Scher, the Director of the Masters in Public Health program at St. Ambrose University. Today, I'm going to work with Professor Erica Thomas, who works in the Masters in Public Health program and also in the Department of Kinesiology here at St. Ambrose. And we're going to provide you more information about how to battle misinformation about COVID. First, let's go to the numbers, and where should we go to get the most accurate numbers? This map from Johns Hopkins University actually drills down the data looking at the number of cases, confirmed cases in each county in all 50 of our states. Right now, the majority of the cases are still in New York City, and Washington State. However, currently March 26, 2020, there's 145 cases in Iowa. And in Illinois, there's 1,875. There is some clustering around Chicago in the suburb area, but it's important to note that those almost 2,000 cases in Illinois are in 35 counties and have affected the population from ages 1 to 99. So right now I'd like to introduce Dr. Thomas, Professor Erica Thomas, who's going to talk a little bit more about misinformation and where you can go to get the accurate facts. Take it away, Dr. Thomas.
Right now, alongside the global pandemic resulting from COVID-19, we are also dealing with what has been termed an information pandemic, or as the WHO, or World Health Organization, has been calling it, an information pandemic. And essentially, this refers to the concept that as we are inundated with information from social media, news feeds, and other well-meaning private messages, sorting through all of the information can be very difficult. Oftentimes, what we may be viewing is misinformation. And misinformation is slightly different from disinformation in that it is typically not done to be intentionally harmful. It's usually wrong or incorrect information that's passed along, usually with the purpose of being helpful or informative. But as our fear and uncertainty surrounding this pandemic grows, we become increasingly susceptible to false and sometimes hazardous claims that speak to our need to have the latest information and to protect ourselves and our family. So too often, we may end up passing along this information and exposing loved ones to potentially dangerous hoaxes and falsehoods. We are in a certainly unprecedented time in many ways, and this is an unusual phenomenon in that it's the first time we've had a pandemic and a population relying heavily on social media for information occurring at the same time. Of course, this is on the radar of the World Health Organization, who coined this infodemic term in February. The danger is that an overabundance of information can make it extremely difficult to find reliable and trustworthy sources when we need it. So to take a look at some examples of this, a few major categories have kind of filtered to the top of this misinformation. So for example, this may come in the form of fake cures or preventative measures. Perhaps false information about the nature of the virus. So it's just a cold or a normal flu, or that children can't catch it. Or the third category is that of conspiracy theories. Hopefully we can mostly recognize these as misinformation, but it's not always that clear cut. So in a survey done by the Pew Research Center, and this actually came out last week on March 17th, so might be slightly outdated by now as things are changing very rapidly. But most Americans surveyed in this survey found that the news was following COVID-19 closely and that it was being done very or somewhat well. However, about half of those surveyed said that they had seen at least some made-up news about COVID-19. So there's no doubt that this is rampant today. So with this being as large of a problem as it is right now, many officials are calling on social media platforms to have some accountability for the abundance of misinformation and how readily it spreads in this environment. So, for example, one solution was the Facebook formation of the COVID-19 Information Center, which you should be able to see if you happen to use Facebook and access your account. It might prompt you to follow that reliable source. So that's one mechanism that social media platforms in particular are making some changes. Some platforms are also drafting influencers to spread accurate news. And while misinformation in this manner is a problem that we have dealt with for a long time and fight daily, so for example, think about the elections, this is a moment where misinformation can have real life and death consequences. So we would like to see more being done here on the part of the media platforms. In the meantime, while media platforms are attempting to get this problem under control, we can all do our part. So what can you do? Frequently, peddlers of false information will prey on our biases and our behaviors, particularly in a time of crisis. So initial steps include arming yourself with facts from reliable sources and being very cautious of what you share. Of course, we all know we've got good, reliable sources in the Center for Disease Control and the World Health Organization. And ideally, we can treat anything that's not linked back to a reliable source with skepticism. And we can sort of compare this to hygiene. So we all have good hand washing behaviors down pat now, right? Everyone's washing your hands for 20 seconds at least. And so just as we're enforcing good hand washing protocol, we want to be enforcing some caution with what you spread information wise. So one way to think about this is perhaps consider doing 20 seconds of research prior to sharing anything. Maybe this comes in the form of checking comment sections to see if anyone has posted a link to a fact check or reliable source confirming or denying the statements that you're reading. Another option is to do a quick Google search just to see if the item in question has been fact checked or confirmed somewhere else. You can find a lot out in 20 seconds. Research does show that we are instinctively more likely to trust images and video, which are easily taken out of context or manipulated. So a Google image search as well can help you determine the validity of images you might see online. Finally, most media platforms do have an option to report a post of something that you find in your research to be false or incorrect. And so, for example, in Facebook, if you do the click on the I, you can report it as false information, and it will then be removed before it can be shared more frequently. We're learning more each day, but it may take weeks or longer before we have responsible answers for all of our questions surrounding the current pandemic. So we want to resist the temptation to fill that vacuum with unreliable information. One resource to help sort through the onslaught of information that's happening right now is the News Literacy Project. And this is the website shown on the screen right now, newslit.org. And this is a great resource for providing links to reliable sources. And it also has some guidelines for news literacy that will benefit us now and beyond.
Thank you, Dr. Thomas, for this timely information. Just yesterday, the FEMA website came up with a rumor control website. So I'd like to share this link with you, this hyperlink with you. Please go here before you start to share any information. This just shows our nation's federal efforts to try to stem the tide of misinformation. Please don't hesitate to contact us directly if you need any more information. We are happy to provide it. We are staying on top of the situation as best we can. Thank you so much.